this is kind of new to me, a town hall virtually. This is new territory for me, but I'm honored to be the host of tonight's event. So just to properly introduce myself, my name is Mike Auseré, and I'm the Vice President of Business Development for Eversource. I live here in Connecticut and based in Berlin, and I'm also on the board of directors for the United Way, and have been in that role since 2013, 2014, and I thoroughly enjoyed serving on the board. And I'm also the treasurer for United Way of Central and Northeastern Connecticut, and also a proud member of United Way's Tocqueville Society. So again, I was honored to be asked to serve as the host, but we've got a full agenda. So I'm going to make a few introductory remarks, and then I'm going to try to get us going. So let me start off by saying I wanted to thank all of you for joining us in this virtual leadership town hall, and we're excited to have members of both our Constitution and Tocqueville Society here in attendance. And we also have folks that are gold level members in the United Way's Emerging Leader Society, also known as ELS. So thank you for joining us. And finally, I wanted to thank corporate and foundation leaders who are also present this evening. So thank you for attending. So United Way's town halls, like this evening's event, are intended to share information and hear your thoughts on a number of items, including issues affecting the well-being of families and individuals and children in our neighborhoods and community. Second, one of the intents of a night like tonight is hear how the United Way, in partnership with the community and business leaders and philanthropists like you, are responding to current issues such as COVID-19. And then finally, it's a forum for us to discuss that how, when we unite together, how we can create a community in which everyone has equal opportunity to succeed and thrive. So that is the overall mission of events like tonight. Before I begin, I think several of you that are in the United Way's Leadership Society, I want to provide just a little bit more information about these societies. There's various societies. One is our leadership donors, and these are individuals or couples who contribute $1,000 or more annually to the United Way, either directly to support the United Way's work or to the organization's role as a steward for donor organizations to qualified nonprofit agencies. That's the Leadership Society. You then have the Constitution Society, and that's the United Way's recognition program for donors who make a gift in between $1,000 and $10,000. And then finally, you have the Tocqueville Society, and that's United Way's worldwide global donor recognition program for those that give $10,000 or more annually. And the intent of these societies is to develop a stronger sense of community and connection amongst these local philanthropists. And its intent also is to offer networking, engagement, and educational opportunities for its members. Tonight's such an event. And a statistic that I love to learn is that these societies comprise over 1,500 members across the United Way, who collectively contribute over $4 million to the United Way's annual campaign. So a very impactful group. Everyone participating in this evening's event are philanthropic leaders in our community, and your gifts are critical to sustaining the work of the United Way and its partners in our community. And on behalf of the United Way and the board of directors of the United Way, I wanted to thank you so much for your generosity, your leadership, your compassion, and your commitment to creating positive change in our community. If there's ever a time for that leadership, it's now. Our communities are in such a challenge state right now as this pandemic continues. So now I'd like to get our town hall started. So today, February 11th, which is 2/11, is also National 211 Day, recognizing the importance of an easy to remember 3-digit phone number, 211, that's available 24 hours a day, 7 days a week, to connect people to essential services and resources during a crisis or personal time of need. I was talking to Kim earlier this week. I have always heard of 211. I have never used it myself, nor have I actually known the history of 211 and its scope. I'm truly looking forward to this evening's content as we learn more about it. Just a little bit of history on this. In Connecticut, 211 began as InfoLine in 1976 as a public-private partnership of the United Way and the state of Connecticut. By the mid-80s, InfoLine gained national recognition as a model system, and then in 1999, 211, really not that long ago, in 1999, 211 replaced InfoLine's 1-800 number. And Connecticut became the first state in the United States to use 211 statewide. It is now a national program. 211 is a program of the United Way of Connecticut and is supported by the state of Connecticut as well as Connecticut United Ways. Today, we want to celebrate 211 and the wealth of information it provides to people in need, those serving people in need, and key decision makers. During tonight's town hall, you will learn more about United Way's 211 information and referral service and how it's being used to connect people to critical resources. We'd like to share with you how 211 is being leveraged to respond to the impact of COVID. You'll also hear how data collected by 211 is being used to better understand community conditions and inform decision-making by the United Way, partner agencies in the state of Connecticut. You'll also hear how businesses are using 211 to enhance the services they offer to its employees and customers. Cora Hall from the Hartford will share how her company is partnering with 211. And then finally, you're going to have an opportunity to ask questions. We'd like this town hall to be interactive. It's a fairly intimate group. So don't be shy about asking questions. You can use the chat box in Zoom, and we're also going to have a Q&A session towards the end. The plan is to conclude tonight's town hall on time at 6:30. To kick off this evening's presentation is Annie Scully. Annie is research analyst and community outreach coordinator for the United Way of Connecticut. This past fall, Annie participated in our Tocqueville Society Town Hall focused on the 2020 ALICE report. And for those of you that are not familiar with ALICE and that an acronym, ALICE stands for Asset Limited, Income Constrained, and Employed. And it's a strata of households that, despite having a member of that household who is employed, still struggle to make ends meet because the cost of living is outpacing wages. And for those of you that may not be familiar with ALICE, I encourage you to Google it, look it up. And the statistics in Connecticut, it's perhaps it's not surprising, but it's really eye-opening to see that the number of households that fall in that strata and are struggling. ALICE households are many of the households served through United Way's partnerships and work in the community. You'll hear more about ALICE in today's presentation and how 211 supports households in our region that are facing financial insecurity. Today, Annie is here to provide us with an overview of 211. Annie?
Hey, thanks, Mike, for that great introduction. And hi, everybody. It's nice to see many of you again and to see some new faces as well. As Mike said, my name is Annie Scully. I am a research analyst at United Way of Connecticut. And before I sort of kickstart this presentation, I just want to emphasize that, as Mike said, all of you are critical to sustaining the work that all of our Connecticut United Ways do, but in particular our 211 service. We rely heavily on contributions from our Connecticut United Ways network. So thank you. I just want to make sure I say that out of the gate. And happy 211 Day. It's really nice to be here celebrating with all of you today. So 211, as Mike said, it's a statewide service. Kate, do you want to jump to the next slide? And it's a free, in a sentence really, it's a free confidential information referral service that does connect people to those essential health and human services 24 hours a day, 7 days a week, either online or over the phone. I think many of you probably have heard us in the news for, everything and anything related to COVID these days. But at our core, we are that traditional information referral service, but we're also a blended contact center, which means that in addition to providing traditional information referral, referrals to local food pantries, referral to ride and transportation services, a referral to various support groups across our state and other community level resources, we are a certified crisis intervention service. So we have that accreditation of AIRS, which stands for the Alliance for Information and Referral Services. We're also accredited by AAS, which is the American Association of Suicidology. So our contact center and our individual contact specialists hold that intervention certification in order to be able to handle those really difficult but really important crisis calls that we receive from youth and from adults across our state. We can go ahead and jump to the next slide as well. So last year, in 2020, we responded to more than 3 million inquiries from help seekers across our state. And that's almost a 500% increase from what we saw in the previous year. It's a 475% increase in volume to our contact center, both online and through our phone. You'll see that at the top of that those top need charts is that healthcare category, which encompasses our COVID-19 response. And I'm going to focus a lot on that a little bit later, but I also don't want to gloss over the other important services in connection to services that we provided this past year. So housing and shelter was that second category. TwoonOne serves as that point of entry or front door for the coordinated access network across our state, which means that anyone that's homeless or imminently homeless can dial 211 to connect with a contact specialist that can first and foremost help them navigate through the available resources, help them problem solve to find natural resources, but then if necessary, connect them to that necessary CAN appointment to begin that process of finding shelter and transitioning into more supportive and permanent housing. We also handled a record number of food requests. So COVID-19 has really sort of underscored the critical need that so many people have to access those community level supports, even if they go a week or so without a paycheck. So our request for food resources, people trying to access our food pantry system and home delivered meals was at an all-time high. Utility assistance also makes up one of our top 5 resource requests this past year. So individuals that need help paying for their heat or their water bills. And then finally, that mental health and addiction, that category that encompasses those individuals that are calling us that are actually in crisis, that are either their friend or their family member, or they themselves are battling an addiction and need to talk to someone to navigate through the available resources to handle that. Go ahead to the next slide. So in addition to those critical sort of contact center supports that I outlined, we also operate a number of specialized services here at 211. And Mike, I heard you say out of the gate that you've never dialed 211 before, but I wonder if you're familiar with any of these specialized services that not everyone knows do fall under that United Way of Connecticut specialized service umbrella. So 211 Childcare is one service that we operate on behalf of the Office of Early Child Care. So that helps families to find appropriate child care programs to meet their needs. We also operate the state's child care subsidy program known as Care for Kids, which helps connect parents that have low income to various child care programs across the state. The Child Development Info Line connects parents to services for children that might have a suspected or diagnosed developmental delay, and it serves as that central intake for the Birth to 3 program. Our Youth Mobile Crisis Intervention Service is that central intake for crisis intervention services for youth. That's available 24/7, just like our core 211 service is. I mentioned earlier our 211 housing program, which serves as that point of entry to the coordinated access network in Connecticut. We also have a 211 navigator online, which helps to screen for potential eligibility for 23 state and federal assistance programs. We flagged that as one of our critical specialized services because it's such an important tool for people to know that by answering a few non-intimidating questions, we don't want to know your name, we don't want to know how much you make, or we don't want to know how much your social security number is, but we do want to make sure that we can grab some basic information to help you connect to some basic eligibility programs. And then finally, the Action Line. So that's a new program for us here at 211. Action Line stands for Adult Telephone Intervention and Options Network. And so that's the adult mobile crisis line across our state. So in addition to youth mobile crisis, we now are that point of triage or that central intake for adults 18 years and older who are facing an emotional or psychiatric emotional crisis in this state. So I'm going to focus a lot of today's presentation on the newest project at 211. It's not really new anymore. It's because back in March is when we first began this role of being sort of the COVID response information line for the state of Connecticut. And the reason that we were asked to stand up these various specialized lines and provide this more intentional support around response and recovery to the COVID-19 pandemic is because at our core, 211 is part of that state of Connecticut's emergency response framework and is a gateway to these services related to emergency, disaster, response, and recovery. So what that means is that the functions under that umbrella include information dissemination, rumor control, connection to programs and services, situational reporting, which occurs every day, volunteer and donation collection and management, call trend reporting and data collection, any kind of temporary hotel placements that individuals need in order to stay safe and healthy, transportation coordination, and then any kind of case management coordination. So in early March of, I guess last year of 2020, the Department of Public Health asked TwoonOne to stand up the COVID-19 public information line. And since we have stood up that line, our contact specialists have handled more than 146,000 calls. So when an individual dials 211, we're documenting that caller's need, we're connecting that caller with available resources, we're reporting call trends and rumors and unmet needs to the State Emergency Operations Center. And then that data is being used to help inform announcements from the governor's office and to identify gaps in services. And that's really one of the key pieces that the governor and the Emergency Operations Center is using to make decisions and using to allocate available resources to those residents and communities that are in need. So here's a quick snapshot of data, and this is really intended to show you guys the volume of need and how the volume of need has increased since we've taken on this role of the public information line for COVID-19. But what's important to remember is that even before COVID, this was a role that 211 has played in communities. We've always been that one call away for individuals that need connection to services or that are having a situation or emotional crisis. So this is not a new role for us to play, but once again, this COVID-19 pandemic and the accompanying economic recession, financial crisis that's occurred, it's affecting so many people, and so many people's ability to keep their lights on, to pay their bills, to keep food on their table, has really elevated the volume of need that people in this state are seeking. So as you'll see, if you look at 2019 to 2020 of March to February, and then of March 21st to 2020 to February 9th, which is just a few days ago of 2021, you'll see that we've seen more than a 627% increase in volume to our contact center, and that's online and over the phone. Some of the notable increases are first and foremost that healthcare category, that COVID-19 testing, COVID-19 vaccine information, questions about symptoms, and other general questions related to COVID-19. Once again, we've seen a huge uptick in our food resource. So individuals that are calling looking for food pantries or home delivered meals or school meals, utility support, individuals that need help, paying their bills as far as gas, heat, and electric, employment and income, so unemployment insurance, financial assistance. Those are some of the key questions and key needs that people are presenting when they're on the phone or when they're searching a website. And then once again, that housing and shelter category, so rent and mortgage assistance. We've been lucky enough in this state to have an eviction moratorium in place to allow people to avoid eviction, but we know that many people are still extremely anxious about when they are going to be forced to pay their rent again, or when they are going to be burdened with the possibility of an eviction. So those calls continue to flow into our contact center. And so I just want to take a step back quickly and talk a little bit about how our role with COVID-19 has evolved and some of the key sort of tangible items we've been asked to deliver in partnership with the state of Connecticut. So in early March, when we first stood up this COVID-19 public information line, our role was really to provide information, education, and warm line support. So we used trusted embedded sources such as information from the Department of Public Health and information from CDC to provide consistent and accurate information about this novel virus. And that was really important to a lot of residents. There was a lot of unknown. We didn't even know what COVID-19 was. We didn't know how the virus was spread. We didn't know how to prevent contracting COVID-19. We didn't know that the cautions that surrounded this novel disease. So a lot of people were calling us confused, nervous, and anxious. So providing that warm line support and providing a friendly voice with trusted and accurate information was so important to so many residents. I can't say enough about our contact specialists that field those calls. They're really wonderful people, and they're really good at their job. And I know that they were able to provide sort of a comfort to those people that didn't have really anyone else to talk to about how they were feeling during this time. In addition to that our education, information, warm line support, we were also asked by the state to help with shelter decompression. So what that meant is that we worked with the Department of Housing and the Coordinated Access Networks, those CAN networks, to compress shelters by transitioning individuals that were living in shelters to hotels and other supportive options. We were also asked to help coordinate PPE donation management. By doing that, we established an intake form, and we coordinated with the DPH donation management team to distribute donations to hospitals, nursing homes, long-term care facilities, and other agencies. And so these donations included masks, gloves, respirators, hand sanitizer, and other important PPE equipment. We also were asked to work with the disaster assistance and response technology platform. So we worked with volunteers, which is called the Voluntary Organization Active in Disaster, CTVOAD is the acronym for that, to stand up this important platform to help match volunteers to help out with homeless shelters and feeding programs. And it was a really important service, not only for individuals that were looking for a way to give back, but also to meet that critical need. So many of our community resources were overwhelmed with volume of need, and they needed that extra support to keep their operations going. And finally, we coordinated the delivery of shelf-stable food and prepared meals through a really wonderful program called the Ride United Last Mile Delivery Program. It's a partnership between United Way Worldwide and DoorDash that has helped us to provide free delivery of shelf-stable food and prepared meals to people that are in need. The next phase that we were tasked with was communicating changes in travel and school and business guidance. We know a lot of people found confusion with the opening and reopening and closing of various businesses, the different business requirements about how they had to reopen safely to ensure that people were safe and employees were safe. That required that we also set up a non-compliant call line for businesses. So employees and individuals and general public could call this line or fill out a form to let us know businesses that might not be compliant with guidance from the governor's office. The next sort of step in this process was to create and maintain a public database of COVID-19 testing locations. And that might sound easy, but it really did require a consistent outreach to ensure accuracy. Currently, we have about 280 locations located in our database of COVID-19 testing locations. So we're constantly reaching out to those clinics to make sure the hours of operation are correct and the services are still the same. Which brings us to the next phase of this response, and that's creating and maintaining a public database of COVID-19 vaccine locations. Once again, a lot of outreach to those providers and those clinics to make sure that the information on our website is accurate and that people that are seeking those services are able to find the information they're looking for. Currently, we have about 140 locations. All of these locations, is important to note, do require that you make an appointment. So there's a lot of great detail on the website about how to go about doing that. And then the final step in this process is where we currently are, which is we are asked to stand up Connecticut's COVID vaccine appointment assist line. So the number for that line is 877-918-2224. If you've been watching the news recently or listening to Governor Lamont's press conferences, you're no stranger to that line. So this line was set up specifically to serve those who cannot schedule a vaccine appointment on their own without the help, even if they have friends or family or other natural support. If they're still not able to schedule that line because of a technology barrier or a language barrier, this line can be used to help those individuals schedule their appointment. So a little more information about the COVID vaccine appointment assist line. I can tell you that in the last 24 hours, this line alone has handled more than 7,000 calls, and we've scheduled more than 5,000 appointments on behalf of Connecticut residents. The map on the screen is a little outdated, but it shows that we do sort of have this statewide service area. There's locations across the state that we're currently scheduling for. Our hours of operation we're 7 days a week from 8 a.m. to 8 p.m. Then we're booking, like I said, locations across the state, and we're continuously onboarding new locations to help keep available appointments up on the website. Right now, because of the overwhelming volume that we've had on our COVID vaccine appointment assist line, we're dealing with a large number of callbacks. So we have about 26,000 individuals that are waiting to have a callback, which is great because it shows that there's a lot of interest in getting the COVID vaccine. It shows that people want to take that step to keep themselves safe and their neighbors safe and their family members safe. But with the announcement of the eligibility increasing in the state, so now we're scheduling for people 65 and up, there were about 300,000 individuals that became eligible for this vaccine. So we're actively working to respond to those calls and to keep people in the loop about how they can access other ways to schedule their appointment. And that brings me to this last quick slide. So information about the COVID-19 vaccine clinic is not, you don't just have to use that line to schedule your appointment. There's other resources available on our website. So you can first and foremost go to ct.gov/COVID vaccine to get the most recent information about the various phases of the vaccine rollout. But you can also go to www.TwoonOneCT.org/vaccine clinics to access a statewide list of various vaccine clinics across the state. So with that, I'd be happy to answer questions or talk a little bit more about the different roles we've played with this COVID-19 response. And thanks again for your time.
Annie, that was a great.
Thanks a lot, Annie. This is Tammy Freeberg from the Village for Families and Children. And this is really incredible. I didn't know that you had the vaccine assistance line, and I think it's really critical. So I'm so excited to hear about it. I'm also wondering, I know there is new federal legislation around suicide hotlines, and there's a new 3-digit suicide hotline number, 988. And I'm wondering how that interacts, if at all, with 211.
Tammy, that's a great question. So we serve as the suicide line for the state of Connecticut, and we actually are the backup to the national suicide line. So right now, when people use that line, they're actually triaged right back to our 211 service. There was actually a push to make 211 that national suicide hotline number, and I'm sure for good reason they chose to use a different line, but those calls still do flow right into our contact center. Great question.
Hey, Annie, it's Mike. I had a question. I'm so curious. I mean, I was stunned to hear the increase in volume. Maybe not surprised, but just the magnitude. I think you said over 600% increase in call volume or contact volume. How did you absorb that from a staffing standpoint?
Yeah, so we are so grateful for the support that we have from the governor's office and from the Department of Public Health, and it's been a challenge. I'll be honest. So we've continued to onboard new staff. We have more staff members in our contact, even though no one's there because we're all virtual. We have more people picking up the phone than we've ever had, I think, in the history of 211. We onboarded 125 new staff members just to handle vaccine calls. So we are locked and loaded. We're doing our best to handle calls in the fastest way possible to provide people with the best service possible. But even with that, we know that there's other barriers. So for example, availability of appointments is one issue that we're battling right now through the VAL, which we call the Vaccine Appointment Assist line, but also access to the vaccine in general. If people watched the governor's press conference earlier today, I think it was on at 4 o'clock, there is, a shortage of vaccine across our state. And we know that supply will be replenished. We're confident that there's going to be new vaccines rolling in very soon, but people are anxious and for good reason to get this vaccine. So juggling, the volume of call, but also the shortage of vaccine is something that our contact specialists are navigating through with every call.
Well, thank you. Thank you so much for your leadership around this. Talking about rising to meet an incredible need. So thank you. Thank you for the presentation. If there are other questions for Annie, we are going to have a Q&A slot towards the end, so we can open up then, but I think we should keep going here. So now I want to introduce our next presenter, and it's someone that I think you already know, United Way of Central and Northeastern Connecticut's President and CEO, Paula Gilberto. Paul?
Well, thank you so much, Mike. And I just want to thank you for your board leadership and also for being our gracious host this evening. I also want to thank Annie Scully. We oftentimes refer to Annie as our rock star, and I think based on the presentation, what she has shared, and the passion by which she shares this information, you know why we refer to her as our rock star. You're also in for a great treat. Later on, you're going to hear, in a few minutes, you're going to hear from Cora Hall from the Hartford. And I can just share with you that not only is she exceptional, but the company is as well. And you'll hear more as to how they've used 211 and the business case they have for using 211. I just want to take a few minutes of everyone's time tonight to, first and foremost, thank all of you for what you do. And for those that are very generous donors to United Way, I hope you can hear and see from what Annie has presented the value of your dollars designated to our local United Way and what that means in terms of ensuring that people are helped, that this service is available 24 hours a day, 7 days a week, 365 days a year. Your one gift to United Way helps us to support 211, along with a variety of other community-based organizations that 211 in terms makes referrals to. So it's a great way of recognizing the value and the magnitude of that gift and the return on investment when we think about the number of lives that have been reached. As Annie mentioned and Mike mentioned, we're celebrating National 211 Day. I can't think of a better way of doing it, and with better people. But I did want to note a little bit in terms of how our United Way uses 211 data, because not only are we a contributor, we're also a user. So 211, as Annie covered, as you saw from the slides, just continues to be there for Connecticut residents, and very particularly as we navigate through all of the challenges with COVID-19. You saw clearly all of the impact in terms of a connection to food, to rent, to utility assistance, et cetera, and clearly keeping people current about COVID-19, testing, vaccinations, et cetera. But we use it for a lot more than that, right? Not only are we using this as individuals and as professionals, as we go to the next slide, just want to share with you how we use 211 in terms of shaping what we should be investing in with respect to donor dollars, with respect to steering volunteers towards great opportunities, with respect to being a consultant and an advisor to corporations in terms of their philanthropic desires, et cetera. So one great example is at the outbreak of the pandemic in Connecticut, we quickly stood up our United Way's Emergency Response Fund. It's called Neighbors in Need. And we looked immediately to what was top of mind for people calling 211 or going to 211's website. So it was very informative in terms of very quickly giving us insight, not only in terms of what was top of mind for people, but it gave us insight in terms of unmet needs. So we had a handle as to the calls and the web hits that were coming in, but we also got a very quick handle in terms of where there was not capacity, where nonprofit agencies were over capacity. So that type of knowledge, coupled with the everyday people on the street, the frontline community-based organizations, together shaped the areas that we in turn were going to not only raise funds for, but quickly get those funds into the hands of quality community-based partners in our 52 towns. We also have used this data to influence what we refer to as our ALICE challenge. So ALICE again stands for asset limited, income constrained, employed, folks that are working hard, but their income is not keeping pace with the cost of living. And certainly we know that even more of those families that were teetering on that line may have slipped drastically into financial instability as a result of the pandemic. What we've done, however, having had an ALICE report now for 8 years, 4 different reports, we're looking at community trends. And we noticed that with a few communities, there was an increase in ALICE households. So we went to them, we had conversations, we wanted to gain some insight. And 2 communities, Wethersfield and Bloomfield, wanted assistance in terms of doing a community problem solving effort. So we facilitated conversations with ALICE residents, and included in that were community-based organizations, representatives of town government, representatives of the school system, to really dig in. What were the challenges that ALICE households were facing and what could be done about it? Key to all of that was sharing the 211 data for what people from Wethersfield and people from Bloomfield were calling about and what were they accessing on the web, so that we had that knowledge in terms of what was top of mind for people. Again, we could look at the database and we could see were there unmet needs as a result. And the critical piece with both of these communities is that they both concluded that it wasn't for lack of resources. It wasn't because there weren't enough services. It had to do with people perhaps not knowing how to get to those services. What are they and how do I get there? So in both instances, the 211 data and orienting them to 211 resulted in more residents being more knowledgeable about what was available and how to access that. Very important, so that we're maximizing services and not coming at it with an assumption that there aren't services. We also have introduced 211 to our business partners so that they can better serve their employees and their customers. You're going to hear, in a moment from Cora, but I want to give you a couple of examples of how we have had this happen. So we have been in conversations with one of our big food wholesalers, very big company, multiple locations in our service area. And I don't know about you, but I like to start my conversations off with our colleagues with, tell me what's top of mind for your company. And we talk about that and listen. And then what are you finding is top of mind for your employees? What's bubbling up for them? It just tells you an awful lot about what's going on. In the case of this big wholesaler, what was top of mind for them was that they had incredible turnover in staff. And they said oftentimes the turnover could be avoided. And they also commented on the fact that their supervisors in this warehouse were really put in these awkward situations of being social service folks. So when we tapped into that, what we found was that they had a lot of employees that were facing financial hardship, but coming to their supervisor almost too late for anyone to do anything about it. So someone's coming in on a Thursday saying, I can't come to work tomorrow, I'm being evicted. Now, if that person had known, had felt comfortable, had gone to the supervisor weeks before, and the supervisor knew about 211, there might have been an opportunity to connect that individual to services. So what we did with Annie's help was to arrange for a training of their frontline supervisors so that they knew what was available, and in turn, they could make that available and that awareness to their employees. We're currently working with a school district in our service area who felt very strongly that two big issues for their families right now, food and stable housing. And their staff, their teachers, their paraprofessionals, their social workers, feeling very, very, very just insecure and unable to help these families with those needs. So we said, well, what if we were to do a series of orientations to 211, not just for your social workers, but for the families themselves. And we can do that both in English and in Spanish. So that's in the works as we speak. And then the superintendent said, well, can you do it for our own staff? Because they're struggling as well. And I don't think they know where to turn. So again, there's this element about getting the word out. I'm just going to ask our colleagues that are listening to this, and we're going to share the recording with all of our leadership donors. If you represent a company or a civic association and you want to talk about how can we better plug into these kinds of services, what can we do to better help our employees know about this? Or if you're a company and you have very specific business priorities, corporate social responsibility priorities, please see United Way as your philanthropic partner. We're here to partner for the betterment of all in our community. So I think the person and the company that best exemplifies that is Cora Hall from the Hartford. Just want to note the Hartford and United Way have been partnering for years, just long-standing relationship, and we couldn't be more grateful. I also want to note that the Hartford not only is a sponsor of our Women United Power of the Purse, but for 9 years running has had the single greatest number of associates that attend that event, whether it has been in person for 7 years running or our virtual event. I think that says an awful lot, clearly about them as a company, but also about the commitment that they have to people in our community. So I'm going to turn it over to Cora Hall, and she's going to talk about the business case here.
Thank you so much for that introduction. And I'm truly honored to be here today to represent the work of so many people across the Hartford that were part of this program over the last 2 years. So just by way of introduction too, I've been at the Hartford since 2017, and I run marketing for our group benefits division. Next slide, please. So what do we do in the group benefits division? We provide what we consider to be the bedrock benefits on behalf of employers to their employees. So life insurance, disability insurance, critical illness, accident insurance, and a product called hospital indemnity, which helps offset the cost of a high deductible plan. And we insure 1 in 6 of all working Americans. So it is a vast network of employers and employees. And those employers span small businesses that may have 2 employees all the way up to the Fortune 50. So we spend a lot of time studying the American workforce, both from the employee and the employer perspective. Next slide. And in 2019, when we saw this statistic of 74% of working Americans are living paycheck to paycheck, it resonated with us because we spend time in the call center, certainly in marketing. Everyone who is in my department spends time in the call center, understanding our customers and who we serve and our purpose. And we think very hard about how we can create products and services that can help people. And people, when they go out on claim for either a premature or for a disability, or if they're calling in because they're a beneficiary and there was a premature death. So keep in mind, everyone we insure at the Hartford is still working and under the age of 65. What we see is that oftentimes physical or emotional pain collides with financial realities, and it happens to these families instantaneously. It's very fast, especially if you're living paycheck to paycheck and you go out on disability and now that check becomes 30 to 40% of what it was. Or in the case of a premature death, the check disappears altogether. And so people will share things with the person supporting their claim that maybe they can't share with anybody else. And so you hear over and over again these heartbreaking stories. And we are really committed to being able to go beyond the policy and finding ways that we can help families. Next slide. So we created a study. First time we had done this at the Hartford, marketing partnered with our actuarial department, and we wanted to look at our 20 million customers by income and by state. And so we would never know at the Hartford what a spouse or partner contributes to the overall family financial equation. But if you look at this map, it's pretty stunning that, you know, life on the East and the West Coast is very different than across the middle. And in 2019, when we conducted this study, the average combined household income in America was $68,000. So it actually makes a lot of sense that our customers are making on average $43,000 a year. So as Paula mentioned, that poverty line begins at $39,000 so annually. And so when we look at this data, it made us think about how can we create products and services that can help the paycheck to paycheck population. And especially when you think about when bad things happen to really good people. Next slide. So our first step was to learn. So Paula taught us about ALICE, as she mentioned, asset limited, income constrained, and employed. And the Hartford has had a long-standing relationship with the United Way. And so this was new for us, though, in terms of learning about the report and the National ALICE Advisory Council. So the council, which we joined in 2019, does really important work. We fund the reports. So that's the research that is currently being done in 21 states, as Paula mentioned, including Connecticut. And we come together and we talk about the trends and we learn as employers. And what we hear is ideas in terms of employers big and small, thinking about how they can address this population and help this population within their workforce, because it's incredibly important both for retention and for the talent pipeline. So if you think about in our world, if people are working until exhaustion, then that will drive illness and that will drive costs and absenteeism. And that's an important trend for us to pay attention to and to educate our customers, our employer customers, about this population. Next screen, or next slide. So through the work with the council, we also learned about 211. And we certainly knew about 211 from the great work that Eversource does, you know, seeing how it could help with something like a heating bill, but we didn't understand the breadth of what 211 could do, and we were curious. So we put together a cross-functional team at the Hartford, and we did a field trip to visit Annie, who was gracious enough to host us all on an afternoon. And as we heard their calls, we realized instantly there was a connection, because the products or the services that they were able to provide to people in real time in towns and cities across Connecticut were exactly the situations we were hearing in the call center. And we learned from Paula and Annie that the challenge is, being able to promote 211 to people who need it in exactly the moment that they need it. And that's where the Hartford could leverage our reach to be able to foster those real-time connections. So our big goal was, could we educate every customer we have with every channel we have about 211? And that began in the call center. So we were the first insurance company to partner with 211 nationally and roll out training across our 3,000 claims representatives that service the group business. And they learned the breadth of what 211 can do. And I'm going to go into in a minute some of the real life stories and connections that we're making. The next step was the printed packages. So we send out 500,000 packages a year that go out to people who are on disability or people who have lost a loved one. The next step was the online portals. We get about 1 million visits a year to those portals. That's where people upload their medical documentation. That's where they're able to check the status of their claim. And most importantly, that's when they're finding out what they'll be paid and when they'll be paid. And so that's probably the moment where they start to realize when the money's going to run out. And so that's where we're able to promote with seasonal messaging. So in September of this year, we were talking about how to use 211 to get school supplies. In December, we were talking about how to use the service to get holiday gifts. And right now it's how can you get help with heating or food insecurity. So real-time messaging that's reaching a lot of people. The next step was the beneficiary checklist. So this is something that we provide to beneficiaries who ask for it. When someone has experienced a premature death, there's a lot that needs to occur in the first 30, 60, 90 days, which can be incredibly overwhelming. So this is a package that we provide, and now there's 211 messaging in it. And then the last step was employees. So we have a wellness blog. It focuses both on physical and financial wellness, and we incorporated 211 messaging for folks who maybe don't need the service right now, but maybe they know somebody who does, and it can certainly help them down the road should they need it. Next slide. And we're thinking a lot about, will more employees need it? So we did a massive study, both pre and post pandemic. And what we're seeing is that employee stress is at an all-time high. And mental health is a critical workplace issue right now for employees. So the biggest shifts in stress last year were around the social political climate. So employees were very worried about the election and what it was going to mean to their families. They are caring for family members. So, that impact goes both ways, whether it's caring for children and dealing with the challenges of remote learning, or if it's dealing with an aging parent, particularly in a COVID environment, or folks who are dealing with both. And then debt is at an all-time high in terms of employee stress. So, certainly we heard a lot in our survey about employees who maybe are still working, but now their spouse or partner is laid off or furloughed and what that means to them. Next slide. And this is where the trends are to watch by industries. And these are some of the largest industries that the Hartford insures. So there's significant declines in trust from the employee perspective of their employers across healthcare, manufacturing, and construction, and a profound decline in terms of understanding the benefit packages across education, manufacturing, and transportation. So not surprising in the sense that these industries have a lot of essential workers, but really important for employers to be thinking about these trends. So again, getting back to retention and productivity in the talent pipeline, these are workers, as we saw in the past year, are critical to the American economy and keeping our companies running. So there's things that employers can do. And one part of it is, of course, learning about this population and the struggles of Alice. But we're also, making sure that we're just talking about the importance of educating your employees. So these employees probably have never met with a financial advisor, and they don't really understand, the types of policies that these employers are providing to them. And they're incredibly valuable. If they weren't getting these policies from their employer, they wouldn't get them anywhere else. So I personally participated in a bunch of webinars over the summer as the employers were trying to be able to promote the bedrock benefits to their employees. And the questions are really basic. You know, they don't understand, if I go out on disability, what does that mean in my check, and how can I proactively plan for that? Simple questions like, what is a beneficiary? So education becomes critically important. Next slide. And so does innovation. So what are we learning? You know, not only are we making these real-time connections and doing the right thing for our customer, but how can we innovate new products and services based on what we learn? So this summer we instituted technology called text mining, which aggregates the stories and helps us boil up some of the key issues in real life scenarios that are impacting the customer. So, you know, first and foremost, the trend of transportation. So if your check is reduced, one of the first things families do is sell the car. And so if they sell the car, then that means that they can't get to the doctor's appointments. If they can't get to the doctor's appointments, they can't get back to work. And so, you know, certainly through the council, I heard a lot about what employers are doing to help their ALIS population with transportation, and 211 can help with that. EAP, so employee assistance programs. A lot of companies will offer anywhere from 5 to 10 sessions of counseling, but that runs out, and grief is long-term for a lot of families, and so is critical illness. So the ability to be able to access things like support groups, or even extending employee resources around mental health is really important. Certainly the beneficiary stories are heart-wrenching, you know, especially when there's young children involved, and the last thing people want to do when they just lost a loved one is think about moving or disrupting their children, moving schools, or taking them away from their friends. So being able to connect them with services that can help bridge the gap and do some of the negotiation with the bank if there is an eviction situation. And then it's just the basics. It's food insecurity, and it's being able to pay the utility bills. So we're learning a lot, and we're thinking about what we can do with this information to make better products and services for our customers. Next slide. And one of the big commitments that we made this year, we announced in September, is the commitment to upgrade 211.org with a $750,000 commitment over the next 3 years. Being on the council, the national council, and being able to travel and meet leaders across the country, what I heard is that 211.org in Connecticut is one of the best resources there is in the country. And so as we thought about that, how can we bring the best practices that we have here in Connecticut to all of the states that we serve, and also just align with our diversity and inclusion efforts and be able to incorporate things like Spanish translation. So this work, I actually just saw a first prototype earlier this week. It's well underway, and it's super exciting. So just honored to be here and be able to share our story. I'm happy to answer any questions.
Cora, thank you so very much. The testimonial presentation were wonderful, very eye-opening, and so thankful for your leadership and the Hartford's leadership around this. I'd heard a little bit about this in our United Way board meetings, but to hear the full story, it's an incredible one. And I don't know if I would have intuitively made that connection with, and it's so obvious now, but the heart-wrenching stories and the people in need you're going to meet, not you personally, but the Hartford, as folks are calling in claims. It's a powerful story and a powerful opportunity for the Hartford to make a difference, and you have. So I appreciate that.
Thank you.
And Paula, I wanted to also thank you for your presentation as well, and also your leadership that you bring to our community. So thank you for that.
Thank you, Mike.
We are at the bottom of the hour, and we welcomed questions throughout the presentation. But are there any additional or final questions before we wrap things up? All right, I'll make a few closing remarks. First off, I think I'd be remiss if I did not acknowledge that when you donate to the United Way of Central and Northeastern Connecticut, you are providing critical funds that allows 211 to be available for all of us. And again, if there's ever been an important time for 211, this has been the year and the time. So I wanted to thank all the meeting or all tonight's participants, Andy, Paula, Cora. Thank you so much for making yourselves available to the group and sharing your experiences and your leadership with us, and importantly, educating us on TwoonOne and how it's such a critical resource for the community, for all of us. Finally, I wanted to say a special thank you to all the guests in tonight's leadership town hall. Appreciate you being part of this, and again, very much appreciate and grateful for your leadership in our community. Before we conclude this evening's event, I'd like to share with you a few additional opportunities to continue your engagement with United Way. On Tuesday, April 6th, you are all invited to attend the United Way's 96th annual meeting and presentation of the United Way's Community Service Award. The event will be virtual and will take place from 5:30 to 7. Be on the lookout for more information. And again, that's on Tuesday, April 6th. Also, you've heard tonight how 211 call data has informed the United Way of the increased need for services and resources across its footprint to address the unprecedented challenges brought on by the pandemic. In January, the United Way of Central and Northeastern Connecticut announced the launch of the COVID-19 Fund. And Paul, I suspect that was January of 2020, but announced the launch of the COVID-19 Fund to respond to the growing needs of local families for food, housing assistance, and employment, as well as to support the education needs of children and youth. Please consider making a donation to the COVID-19 Fund today. You can do so by going to the donate page on the United Way's website at www.unitedway8.org. And even if you've already made a donation through the annual pledge campaign, please consider making an additional donation for this important cause. And your support is greatly needed. So this concludes tonight's town hall. Thank you again, Amy, Paula, and Cora, for your presentations. And thanks again, everyone, for your participation. Please help spread the word about 211. Tell your friends, families, neighbors, and coworkers about this free, confidential, and incredibly valuable resource. Thanks again, and enjoy your evening.